Dear viewer, I want to ask you a question. Sometimes we are sad, and sometimes we cry. Should I say that all people who are sad or crying suffer from depression? And I have another question. Sometimes we feel fear, tension, dizziness, and palpitations. Should I say that all people who feel fear or tension suffer from anxiety? Let's think about one last question. Sometimes we forget appointments, times, places, and names. Should I say that all forgetful people suffer from dementia? To all these questions, there is only one answer: no. Very few people who are sad actually suffer from depression. Very few of those who are tense actually suffer from anxiety, and very few people who forget things actually suffer from dementia. These facts decrease our worries, but when things are not okay, we become concerned about our mental health. We want exact answers, but can we receive such answers? Yes, we can, but what? Look, I'll give you an example. Today, if we feel that our body temperature has risen and we are concerned about it, we use a device, a thermometer, that measures our body temperature, giving us the information we need. The next example is similar. If we have a headache and we are concerned about our blood pressure, we use a blood pressure monitor. This device measures blood pressure, thus giving us information about our body's parameters. It seems simple, and we suppose that things are the same for mental disturbances, meaning that if we think, feel, or behave unusually and have concerns about experiencing a mental disturbance, we believe that a device that measures our brain functions will help. That's right, but the only problem is that such a design does not exist. Today, as far as the diagnosis of mental disturbances goes, nothing has changed compared to 100 years ago. Today, just the same as before, in order to diagnose mental disturbances, the psychiatrist asks questions and the patient gives answers. This is very disappointing because there may not be a psychiatrist at hand, and specialist examinations are usually expensive. Plus, there is a lot of shame related to the stigma of psychiatric diagnosis. Practically the only solution that exists today to supply us early information about our mental functioning is self-diagnosis. If we think that we suffer from depression, for example, it is easy to find lists on the internet with criteria for diagnosing depression. The same is true if we think we have anxiety. Lists of anxiety criteria are easy to find on the internet. At first glance, this seems like a good solution, but going deeper, the method of self-diagnosis raises two problems. One, there are many mental disturbances, and to read all these lists and to compare our symptoms with all the criteria is practically impossible. And two, there's almost no circumstance where patients' feelings, thoughts, and behaviors exactly fit a list. Reality is more varied and complicated than that. I've personally known all these things for many years from the many patients I diagnose every day. Many of them came to their diagnosis much later than expected. In trying to help them, I wrote the book Self-Diagnosis for Mental and Emotional Disturbances. It looks like a book, but it's not really a book. It's an interactive device that at the very beginning asks you to present your complaints. Within a very short time, the information received is processed by the device, and you receive the final answer, the diagnosis. You can locate this book on Amazon.com, and I hope that you'll find it very useful, simple, and short, as so many other readers already have. Most importantly, the information you'll receive from this book will calm you. How? It will calm you because it will help you to make proper decisions, and you won't struggle any longer with your thoughts.